after 2 days ago with nausea, vomiting, and dehydration. Today I went through her health assessment and she had normal vital signs and there were no abnormal findings and she's able to keep down food. So in my opinion, she's ready for discharge.
Hello, my name is Nikki. I'm a nursing student at the University of Texas, and I'm going to be doing a brief health assessment on you this morning. Would you mind telling me your name and date of birth?
It's Jennifer Hall, 040895.
Yeah, you didn't miss any. And where are you this morning?
I'm in a hospital in Austin.
Okay, and what day is it?
Today is Thursday.
Okay, great. Thank you, Ms. Hall. So I'll be working with you today under the guidance of my clinical instructor as well as your nurse. How did you sleep last night?
Pretty good.
You did good? Okay. And how are you feeling this morning?
Good.
Good. All right. So the patient's eyes opened spontaneously upon sound when I entered the room. She is alert and oriented to person, place, and time. She has good hygiene and is well groomed with no emesis or foul odor coming from her. She is well nourished with even body fat distribution and has clear and articulate speech with a fluid pattern. She also has good hearing, as evidenced by she can respond to my questions appropriately. Okay, Ms. Hall, I'm going to take a look on the inside of your mouth, okay? All right. What do I need? I need tenderizer, which I got.
We didn't put the leash in.
Okay, will you open up and say "ah" for me? And do you wear any dentures? No? Okay.
Oh, you just push it.
And do you have any pain on the inside of your mouth? No? Okay. So all of her mucous membranes are intact and all of her teeth are there with no discoloration. Her membranes are moist and with no lesions. Okay. Now, Ms. Hall, I'm going to do some vital signs on you, starting with temperature. So we're going to place this thermometer underneath your tongue, and it's going to tell us your temperature. Will you hold it in place? And while it's going, I'm going to check your pulse.
No, it's so much easier. I'll just try to go like this. I was expecting it, but I'm totally untying this. Yeah. I don't even want to do it.
I already have like the sleeve on mine.
So yeah, I'll probably, I'll go just like this, and I'll try to go like right here, and then I guess straight. Yeah, I feel like
So her pulse was 72.
Okay, when you're recording,
we're like nitpicking. They're not going to nitpick. Should I crutch? Yeah, I mean, you're going to have to.
The patient also has 16 breaths per minute. All right, Ms. Hall, while that's still reading, I'm going to look at your skin turgor.
Oh, here, I'll go ahead.
So what else?
Well, you can.
All right, so there's no tinting present, so she's probably pretty hydrated at this point.
What did you use?
All right,
Oh.
and your temperature was 98.2, so it's very good. All right, and since your IV is on this side, is it causing you any trouble? No? Okay. I'm going to check your blood pressure on this arm since you have the IV on that arm. And on this side, we're going to put the pulse oximeter on, which is going to tell us how much oxygen is running through your blood. There's no redness or irritation on the IV site. And on the scale from 0 to 10, 0 being no pain at all and 10 being the worst pain imaginable, how would you assess your pain today? 0? Okay, that's great to hear.
Okay, you're supposed
you might feel some pressure around your arm, okay? All right, Miss Hall, your blood pressure was 108/72, which is within the normal range. I'm going to take this off now. Okay. And this shows that your blood is 99% saturated with oxygen, which is also within the normal range.
Hi, Miss Janara.
Okay. Now I'm going to take a look at your eyes and just make sure that your pupils are responding appropriately, okay? So there's going to be a bright light coming around from the side, starting with your left eye. Stare straight ahead.
Can you tell me your name?
Good. And right eye.
Okay, and your date of birth?
Good. Okay. So pupils are equal, round, and reactive to light. They constrict from about 4 millimeters to 2 millimeters in reaction to that light.
Okay, great.
Can you give me a big smile? Great. There's no facial drooping or ptosis. And have you had any difficulty swallowing recently? None? Okay. Would you mind if I put my fingers on your throat? Will you give me a big swallow? So the swallow reflex is intact. Okay, Miss Hall, now I'm going to check your extremities and just your range of motion. So can you put both hands over your head for me? Very good. Put them back down and cross them.
Okay, awesome.
Very good. And now I'm going to have you squeeze my fingers. Good. Okay, so the patient has good range of motion in her upper extremities, and her muscles tone and strength is equal bilaterally. All right, Miss Hall, now I'm going to lower your bed sheet and do the same thing in your lower extremities, okay?
And then I can see, so you have one ID. See, all right. Go ahead and put my
Okay, would you mind bending your knees for me? Very good. And can you move your ankles in and out? Very good. All right, now first I'm going to check for some
Okay, so it looks
swelling or any edema in your leg.
inflammation or redness. Does it hurt at all?
Okay, so there's no tibial edema or any swelling. And now can I have you push against my feet like you're stepping on a gas pedal? Good. And pull against. Very good. Now I'm going to feel for your pedal pulse. Okay, the pedal pulse is present and regular.
So how has your diet been? So I know you came in with nausea and vomiting. Right, okay, great. And
All right, Miss Hall, now I'm going to move on to checking your heart, okay? So first, can I see your fingertips?
excellent. So now I'm just gonna look into
Very good. Capillary refill is brisk and under 2 seconds. And now I'm going to take a listen to your heart, okay? So I'm going to pull your gown down just a little bit.
Okay, great. So I'm gonna look at you now. Just say ah for me.
Sorry.
Okay, great. So it looks
I'm going to lower your side rail. We'll get it
I
clear.
didn't notice any skin lesions or anything like that. Now, did you have any oral pain? Okay, great. All right.
Very good. All heart sounds are regular with no abnormal sounds heard or extra sounds heard. Now I'm going to listen to your heart a little bit lower so that I can compare it with your pulse.
Right. So just open your mouth, put this underneath your tongue. All right. Now while that's going on,
Very good. So apical pulse and radial pulse are in sync. Now, Miss Hall, I'm going to listen to your lungs. Each time I place my stethoscope in a different spot, there's going to be 6 different spots, and I just want you to take a deep breath in and out through your mouth, okay? Okay.
okay, great. So that was 15 breaths per minute. So that's very normal. Good. So now I'll just.
Very good. So breathing on the anterior side was unlabored, and her breath sounds were clear with no crackles or rails or rubbing heard. Okay, now if I can have you sit up for me, I'm going to do the same thing on the back side, okay? Alright, again, deep breath in and out. If you feel lightheaded at all, just let me know and we can take a little break. Almost done. And one more.
Okay, great. So that was.
Very good. So the posterior sounds are also
That's also very normal.
equal and clear. Now I'm going to check your back for any skin breakdown, okay?
Okay.
Since you have been laying in bed for a few days, we just want to check this to make sure everything's okay. There's also no sacral edema, no dressings that need to be attended to. Alright, now you can lay back down for me. Okay, now I'm going to put your bed in the lowest position so that I can listen to some bowel sounds, okay? And when was the last time you had a bowel movement?
Yesterday.
And is that normal for you?
Yes.
About once a day? Okay. And have you been urinating frequently?
Yes.
And you were admitted to the hospital for nausea and vomiting, but have you been able to handle the food here so far?
Yeah, I was able to keep down breakfast this morning.
That's great to hear. Good news. Okay. So I'm going to lift the sheet down and your gown up just a little bit. And I'm going to squat down on the side of the bed and just look at the contour of your abdomen and see if there's any abnormal lumps or anything. Alright, her contour is flat. And now I'm going to take a listen. Okay, so bowel sounds are present and active in all 4 quadrants. Alright, I'm going to put your side rail back up. Would you like the head of your bed up?
Yes, please.
Yes, okay. Down. Cover you up. Okay, so, and I'm going to put your bed back in the lowest position. Side rails are up, your brakes are on. Your call bell is right here, so just let me know if you need anything at all, and I will be right here. I'm going to check back up on you in about an hour, and so far you're looking good. I'm glad that you're feeling better. Alright, Miss Hall is a 20-year-old female patient, and she was admitted 3 days ago for nausea, vomiting, and dehydration. This morning she's feeling much better, and her skin is rehydrated. It was warm and moist all the way throughout the assessment, so I believe that she is on her way to getting discharged. Thank you.